ladies and gentlemen, if you are liking our videos, don't forget to subscribe and leave the comment as your opinion is always valued. Discrimination increases the risk of young adults developing behavioral and mental health problems. New research examining a decade worth of data has found the effect is cumulative, meaning that the greater the number of incidents of discrimination experienced, the higher the risk. Reported in the journal Pediatrics, the study also found that the effect of discrimination is closely linked to inequalities when it comes to healthcare itself, in particular disparity of care, inequity in diagnosis, and the great difference in treatment, leading to worse health outcomes for those who are being discriminated against. The data was collected between 2007 and 2017 on a group of 1834 Americans who were between 18 and 28 years old at the beginning of study. This was part of the transition to Adulthood Supplement of the panel study of income dynamics survey. About 93% of all the people interviewed report having experienced discrimination. The most common factors were age 26%, physical appearance 19%, sex 14%, and race 13%. With 75% of all lifetime mental health disorders presenting by age 24, the transition to adulthood is a crucial time to prevent mental and behavioral health problems. Corresponding author Von Lai, a medical student at the David Geffen School of Medicine at UCLA, said in a statement, "The study found that participants that experienced discrimination incidents a few times per month or more were 25% more likely to be diagnosed with mental illnesses and twice more likely to develop severe psychological distress. People that experienced multiple successive years of higher frequency discrimination showed a higher risk for mental illness, psychological distress, drug use, and worse overall health. The associations we found are likely also intertwined with mental health care service disparities, including inequalities in care access, provider biases, and structural and institutional discrimination in healthcare, leading to inequities in diagnosis, treatment, and outcomes," added the study's senior author, Dr. Adam Shikidans, an assistant professor of pediatrics at the Geffen School of Medicine. The decade investigated was marked by the 2008 economic crisis that made millennials the first generation to be financially worse off than the previous one. The crisis, described for years as a once-in-a-lifetime event, is now repeating itself as a consequence of the pandemic just 12 years later. The COVID-19 pandemic has brought to the forefront new mental health challenges, particularly for vulnerable populations, Lai said. "We have the opportunity to rethink and improve mental health services to acknowledge the impact of discrimination so we can better address it to provide more equitable care delivery." So if you are looking forward to more interesting news, don't forget to subscribe and comment. Thanks for watching.